Heart disease continues to be the leading cause of death in the United States, fueled by an alarming rise in key risk factors such as high blood pressure, obesity, and diabetes. Despite medical advancements that have helped people live longer with cardiovascular disease, the underlying causes of these deadly conditions show no sign of slowing down. According to the American Heart Association's latest data, cardiovascular diseases claim more lives than cancer and accidental deaths combined. With nearly 2,500 people dying from heart-related conditions every day, the crisis is far from under control. The most recent statistics paint a bleak picture. In 2022, cardiovascular disease caused over 941,000 deaths in the U.S., an increase of more than 10,000 from the previous year. While the age-adjusted death rate saw a slight decline, the sheer number of deaths remains staggeringly high. The report suggests that the surge in heart disease-related deaths during the COVID-19 pandemic may be stabilizing, but this does not signal an improvement in overall heart health. On the contrary, conditions that contribute to heart disease, such as chronic kidney disease, are on the rise. Experts emphasize that kidney disease, closely linked to cardiovascular issues, has increased dramatically in prevalence over the past decade. The statistics on key risk factors are deeply troubling. Nearly half of U.S. adults have high blood pressure, a major contributor to heart disease. More than 72% of adults have an unhealthy weight, and obesity affects nearly 42% of the population. Even more concerning, more than half of adults either have diabetes or are on the path to developing it. These numbers indicate a widespread health crisis, one that is expected to worsen in the coming decades. If current trends continue, hypertension and obesity will each affect more than 180 million U.S. adults by 2050, and diabetes will exceed 80 million cases. The economic toll will be equally severe, with projected healthcare costs for cardiovascular disease expected to skyrocket by 300%. Despite some progress in reducing smoking rates and improving cholesterol management, obesity has emerged as an even greater health threat. Excess weight is now responsible for nearly 500,000 deaths per year in the U.S., lowering life expectancy by as much as 2.4 years. The impact is particularly severe among women and Black adults, highlighting stark health disparities. The alarming rise in childhood obesity further compounds the problem, as more than 40% of U.S. children have an unhealthy weight, setting the stage for lifelong health issues. Experts warn that medical treatments alone will not be enough to reverse these disturbing trends. While new therapies for obesity and other cardiovascular risks are emerging, they will not solve the root of the problem if access and affordability remain barriers. The reality is that heart disease is not only preventable, but largely driven by lifestyle and environmental factors. Without aggressive public health efforts, including better education, early intervention, and equitable access to care, the nation will continue on a path of worsening health outcomes. The grim reality is that heart disease, once considered an inevitable fate for many, has become a preventable epidemic that is spiraling out of control. Without a major shift in public health priorities and personal responsibility, the future will see an even greater burden of cardiovascular disease, placing millions of lives and the nation's healthcare system at risk. The time to act is now, before these statistics become an even more devastating reality.